Hi, I'm Skip Sams, host of the radio show The Truth Is Out on WGHC 98.3 FM here in Chicago. Last week on my show, I had a very important conversation with John Peller. He is the CEO of the AIDS Foundation of Chicago. He came on to inform me and the community about special programs to help those with HIV, AIDS, or at risk and on PrEP during the COVID-19 crisis. Well, welcome to this segment of The Truth Is Out. I am lucky to have with me today the president and CEO of the AIDS Foundation Chicago, John Peller. Welcome back, John.
Hey, Skip. Thank you so much for having me on. I appreciate it.
Yeah, absolutely. When I heard of the great things that you all are doing during the COVID-19 crisis, I wanted to make sure that I could do anything I could to get the information out there. I got this wonderful email that you are providing emergency financial assistance for clients financially impacted by COVID-19 to help with rent, utility, food, and transportation bills. You're connecting with individuals recently released from jail or prison to ensure
Yes.
access to community transitional services and treatment. Delivering support kits with groceries, toiletries, and cleaning supplies directly to the clients at their homes. Securing accommodations and vacant hotel rooms for individuals experiencing homelessness. This is amazing. Reviewing options for purchasing cell phone minutes. They're all important, but I love that you're offering modified behavioral health programming with clients triggered by isolation. John, that's a lot of stuff, and that sounds like a full list that you all have transformed a lot of your services very quickly.
Yeah. So we at AIDS Foundation of Chicago have transformed our services to have our staff working remotely while I think really not missing a beat. And we have to make sure that our clients have their needs met during this current emergency situation. And I'm just so proud of the work that they have done. I think the most important thing that I want folks to know about, and the service that I want people to know about, is the emergency financial assistance for rent, utilities, food, and transportation that's available now. And it's available for people who are living with HIV in the Chicago metro area, but also for people who are taking PrEP. And that's the first. That's a first for us. It's funded by the city of Chicago, which is just amazing that the city health department sees that need. And we're providing that service in partnership with the Center on Halsted, which is running the call center that's taking those applications. And that number is 844 Hub 4040. So if folks need emergency rent assistance, we can help with up to 3 months of rent.
Wow.
And utility, food, or transportation. They should call that number and start an application. And we can turn a check around in about a week, which is pretty amazing.
Who qualifies for that?
So it's you have to live in the Chicago metropolitan area. So it's Chicago and the collar counties. You have to be living with HIV or taking PrEP, and we'll just ask you to send us, a picture of your pill bottle if for folks who are using PrEP, and we're pretty flexible beyond that. You have to be able to show that there was a emergency situation that occurred that makes it so that you need assistance. And for most people, that's as simple as saying, I lost my job, or something else happened that means they can't pay their rent. So we're being really flexible with the documentation that's needed, and just really want to get applications out quickly, because we just do not want people to become homeless right now, and
Right.
to because that's the worst possible thing. So
Right. So is there an income break for someone to apply for this? Is there some kind of income level that they had?
the income requirements are somewhat complicated. So I encourage folks to call the hub number to find out what those are. It depends on sources of income and all that. So yeah, I encourage folks to call the hub number, which is 844 hub 4040, to get more information.
That's awesome. Who is, you said the Chicago, City of Chicago is funding some of the stuff for people in prep. Who is funding? This is a lot that I know you've always offered, like a month
Sure.
for somebody who, and it was like a one-time thing for a month rent, right?
Right, right. It's funded through the federal government, through the Ryan White HIV program, and also the Housing Opportunities for People with AIDS program. So federal programs, and also through private donors. And so private dollars help us meet needs that government money won't allow us to meet. And so private dollars are really critical to help meet the needs of people living with HIV who are vulnerable to HIV.
So how would someone contribute to that fund?
They can donate at aidschicago.org/donate.
So that's with rents, utilities. What would somebody just turn in their utility bills to you, or?
That's right. We do need a copy of the utility bill. We can, someone can send us a picture, snap a picture on their phone, and send that in. So we're really flexible about how we can get documentation. So
would this be something you apply, and I think you said up to 3 months. So will someone reapply every month for it, or is that still, I mean, I know this is all new, so I'm asking a lot of questions that
it's all evolving, and that actually I don't know the answer to, but so we're working to meet those needs and constantly assessing what the needs are and responding to them. So I encourage folks to call the Resource Hub at 844 hub 4040 and talk to folks there to find out, to share what their needs are, and then learn about how we could meet them.
And the transportation, what do you mean by the transportation? Is that like a CTA card, or?
So we can help with CTA cards. There are also situations where we can provide Uber or Lyft rides for folks if they need to get to a medical appointment. I'm also really proud, as you mentioned, that we're able to help people who are homeless stay in hotels, in a hotel. And these are folks who, obviously we're very concerned about folks living in homeless shelters right now because of the risk to their health of becoming infected. So they're with coronavirus. And so we've been able to work with folks who are on their way to housing. So they've been identified for a housing program and are just waiting because landlords right now aren't showing new places. And so the process of finding a home has really almost completely ground to a halt. So we're able to move to help folks short term until we can get them into a permanent place. So it's been a very small program, about 14 rooms, but it's still, I think, important that we've been able to help that way, and really shows how we've been able to adapt to the crisis. And I'm very proud of this.
That's awesome. And what about the kits, the grocery kits and toiletries? Is there toilet paper in there?
So some of our staff went around to about 5 or 8 different grocery stores, putting little bags together for clients who are in some of our housing programs, and then drove them around and kind of dropped them off at the front door and said, "Come get it." And we had some food, we tried to find some puzzles or games to help people to stay entertained, and some toiletries, and we were able to find some toilet paper, so we provided that too. It's really important, particularly for people with HIV who are older, who have multiple health conditions, that they stay home. And so that's one way that we helped folks do that. It's also really important that they stay connected, not just with their friends and family, and with their case managers and their doctor. And so we're hearing that folks are running out of minutes on their cell phone, particularly if they have the government Lifeline program, which many of our clients do. And so we've been advocating at the federal level for funding for the government Lifeline program, the free cell phone program, to give everybody unlimited minutes now that we're in this crisis, so that they, there's all this, don't go to your doctor's office, call them. Well, how can you call if your phone is out of minutes? And this is something that the government can address in the next stimulus bill, or the FCC could just order the phone providers to do this. And so we've been talking to the congressional delegation and our national advocacy partners on this issue, because isolation is deadly right now. And for people's mental health, for their substance use, we're very concerned about the effects of isolation. We have moved to doing some of our behavioral health services, so mental health and substance use treatment, which is on a one-on-one basis. That's all moved to being conducted by phone or video, depending on the client's preference. So that's been one really important way for mental health professionals to stay in touch with their clients and provide really essential supports to them.
So you're saying is this in collaboration with the Center on Halstead, or they're just one of the managers of taking the applications?
The Resource Hub is in collaboration with the Center on Halstead. The mental health services that we're providing, for example, and the food and services that we delivered, that was done by AIDS Foundation of Chicago, independently of the center. Right. So the Resource Hub is funded by the City of Chicago, and it's a new program that helps people living with HIV or people who are vulnerable to HIV connect to services. So it's kind of the 800 number or 311, whatever we want to call it, for HIV services in Chicago. So if folks need access to housing, to medical care, mental health, substance use treatment, if they need medications, if they need PrEP or HIV testing, that's the number to call. And there are wonderful, friendly, loving, lovely people at the Center on Halstead who are working from home, but standing by to take calls. And again, that number is 844-HUB-4040.
That's awesome. And they probably have a lot more resources as well, as far as like the social interconnection and so forth.
Absolutely. They do.
John, how are you personally dealing with this?
I think I have my my ups and downs and occasional meltdowns. I had one this morning and had to take a break and go for a walk. But I'm just so fortunate. I have a roof over my head. I still have a job. I have a partner who I'm sending to the grocery store when it's time for food, and we're just incredibly grateful for what I have, and also for the resources that AIDS Foundation is able to offer to help the community along with our partners. Yeah. So we're spending a lot of time at the office now, checking in with each other, as you're doing, to just check in about mental health and see how people are feeling, and just have conversations that aren't work related. I really miss everybody a lot, and miss just seeing people in the office and getting to see all those wonderful faces.
Right. It's funny how we're learning about each other from these interactions.
We are.
Yes. My cat hasn't come jumping up behind me.
The best part has been seeing cats and babies. So
cats and babies, yeah. Well, John, thank you so much for coming and sharing this information, and stay safe. And
Yes, you too. Thanks for having me on, Skip. I appreciate it.
If you like this program, you can hear us every week on WGHC 98.3 FM at noon on Saturdays. You can also catch us at facebook.com/The Truth Is Out Radio. And of course, you can find me at facebook.com/SkipSams or on Instagram, look for Skipmeister. And my website, www.skipsams.com. Be safe, be well, and love all around.